Affordable Care Act, often referred to as the Obamacare, is a comprehensive healthcare reform law that was enacted in March 2010 under President Barack Obama. Now, this landmark legislation represented by one of the most significant overhauls of the US healthcare system since the creation of Medicare and Medicaid since 1965. The ACA was designed to address rising healthcare costs, improve health insurance coverage, and expand access to affordable, quality healthcare for millions of Americans. Before the ACA, healthcare costs in the US was largely employer-based, leaving many unemployed or low-income individuals uninsured. Rising healthcare costs, lack of access to affordable insurance, and issues with quality of care had become major political issues since the 2000s. The major objectives of the Affordable Care Act is to make the healthcare costs or healthcare system more accessible, affordable, and sustainable across the US. Other objectives are increasing insurance coverage through subsidies and health insurance marketplaces, expanding Medicaid coverage for most of the low-income adults, and then reduce the uncompensated care costs for hospitals and providers, prohibit discrimination based on pre-existing conditions, removing annual and lifetime limits on essential healthcare benefits and everything. The ACA marketplace plans are available to US citizens and lawfully present immigrants, such as those with green cards, work visas, or people in asylum. Now, the ACA primarily serves people who do not have access to the employer-sponsored health insurance or whose employer-provided insurance is unaffordable or does not meet up the minimum coverage standards. So people with part-time, freelance, or self-employed jobs often qualify for ACA coverage. Special enrollment periods also allows the individual to enroll in or change marketplace plans if they experience certain life events such as losing health coverage, being jobless, or changes in households such as getting married, divorce, or birth of a child, or moving into a new coverage area. So the Affordable Care Act aims to expand access to affordable healthcare coverage in the US, enabling employees to obtain coverage through employer plans or health insurance marketplace or government-sponsored programs or even direct purchase. There are certain participation requirements for certain employers. The employers having 50 plus employees, full-time employees, they are often termed as applicable large employers or ALEs. They must provide affordable, minimum essential healthcare coverage to their full-time employees and dependents, or they must face certain penalties. Now, the full-time employees are defined by the ACA are those working on an average of at least 30 hours per week or 130 hours per month. The applicable large employers, ALEs, are required to offer coverage to those employees to avoid penalties. So, what are the employee responsibility? Individuals are required to have health insurance. While a penalty for not having coverage was previously imposed, it has now been removed. Individuals can report coverage on their tax returns as well. All US citizens and legal residents are eligible to obtain health insurance through the ACI. Individuals without the employer-provided coverage or access to government programs like the Medicare and the Medicaid can purchase the insurance through the health insurance marketplace. Many may qualify for subsidies based on income. The employers may subsidize employee health coverage to ensure affordability. Now, employees also typically contribute to a portion of the premium cost, whether through the employer-sponsored plans or other options. There are certain income-based subsidies for individuals purchasing insurance through the marketplace model may be eligible for a premium tax credit if their household income is between 100% to 400% of the federal poverty level. The subsidy reduces the monthly premium cost, making coverage even more affordable. Now, we also have something called a cost sharing reductions. Low income individuals, typically who are up to 250% of the federal poverty level, may also qualify for cost sharing reductions, which lower out of pocket costs such as deductibles and co-payments when using a marketplace plans. If the employers do not comply with the ACA provisions, certain penalties may apply to them. So we have two kinds of penalties, type 1 and type 2. The type 1 penalty applies if an ALE, applicable large employer, fails to offer minimum essential coverage to at least 95% of their full-time employees. Now this penalty for this year is going to be $2,880 per full-time employee. Those are working for the employer. Now the first 30 employees may be excluded from this calculation. Now we also have penalty type 2. This applies to an ALE where the coverage is unaffordable and or lacks minimum value or is not offered to at least 95% of full-time employees, leading to a premium tax credit claim by any of the employees. This penalty is going to be $4,320 per affected employees per year, but may be capped to the total penalty amount of type 1. Let's see one example. ABC Corporation is an applicable large employer with 100 full-time employees. ABC Corporation offers a healthcare plan, but employees must contribute at least $350 per month for individual coverage. Now, one of the ABC's employees, Maria, she earns $30,000 annually. Under the ACA guidelines, her contribution for health insurance should not exceed 9.5% of her household income for it to be considered as affordable. Now, the minimum affordable premium therefore should be $30,000 times 9.5%. That's going to be $2,850 per year. Or when you are dividing that monthly, it should be $237.50. So now you know that she has to contribute a $350, which is about $237.50. So that's not going to be affordable for her. Now, since Maria is required to contribute $350 per month, it exceeds the affordability threshold. So therefore, the alternative coverage and tax credit, because this coverage is not affordable to Maria, she opts to purchase insurance through the health insurance marketplace, where she might qualify for a premium tax credit to reduce her premium cost. So therefore, the employer penalty may apply. Since ABC Corporation offered Maria unaffordable coverage and she has received a premium tax credit, ABC Corporation will offer a penalty type 2 for Maria. Now, how do we calculate this? For each full-time employee who receives a premium tax credit due to unaffordability of the coverage, the penalty is going to be $4,320 annually. Now this is the amount for 2023. Now this amount keeps changing every year. Okay. Now, so if 10 employees qualify for premium tax credit under the similar circumstances, the ABC Corporation would owe 4320 times 10 employees. That will make it like $43,200 per year in penalty type 2. The premium tax credit is a subsidy provided by the Affordable Care Act to help eligible individuals and families to afford health insurance purchased through the health insurance marketplace. There are certain eligibility criteria. Only US citizens and legally present residents may qualify. So, under the income test, if the individual's or household income is between 100% to 400% of the federal poverty level, they may qualify. Now, this 400% has been recently lifted, allowing more people to qualify. Now, married couples must file joint for them to be qualifying for this particular credit, with limited exceptions. Individuals who can be claimed as dependents on someone else's returns are not eligible for credits. If the individuals have access to affordable employer-sponsored coverage that meets the minimum standards, they are generally not eligible for a premium tax credit. The amount for premium tax credit is based on the estimated household income, family size, and local premium rates. The credit is designed so that the cost of the health insurance premium does not exceed a certain percentage of their income. So, how do they receive the credit? Eligible individuals can choose to have the credit paid in advance directly to the insurance provider, thereby reducing their monthly premium payments. And now, when they file the tax returns, individuals can reconcile the advance credit with the actual eligible amount based on their actual income. If they receive more than what they were entitled to, they may have to prepay the excess, or if they have received less, they can claim the difference.